Hello, everyone. Today we are going to discuss general anatomy and patient positioning when taking X-rays. This lesson will improve your understanding anatomy and body positioning to aid in getting the best X-ray views you can when you are out there working in the field. Let's get into it. The term anatomy refers to the structure of the body. A baseline knowledge of the human anatomy is essential for accurate positioning and for correct evaluation of finished X-rays. In preparation for the study of radiographic positioning, we will go over details of common tasks performed during X-ray procedures. These include how you position the image receptor, IR, and how to use it. Proper alignment of the X-ray tube, alignment of body parts, placement of radiographic markers, and giving proper patient instructions are all skills that you should strive to achieve. There are 6 levels of structural organization of the human body. The first level is molecules and atoms. This is referred to as the chemical level of organization. The next level is the cellular level. Cells are the smallest units of living things. Groups of similar cells that work together to perform a common function are called tissues. An organ is a group of tissues that act together to perform a special function. A system is a group of organs that work together to perform complex functions. The 6th and highest level of structural organization is the human body composed of all systems. The skeletal system provides a rigid framework for the body. It consists of 206 bones with other tissues, such as cartilage and ligaments. Cartilage is a tough, fibrous connective tissue that is both stiff and flexible. Ligaments are flexible bands of fibrous tissue that bind joints together and provide connections between bones and cartilage. Tendons are bands of fibrous tissue that attach muscles to bones. The skeletal system is divided into the axial skeleton and the appendicular skeleton. The axial skeleton consists of the skull, spine, sternum, breastbone, and ribs. The appendicular skeleton includes the bones of the extremities, arms, and legs, as well as those of the pelvis and shoulders. The remainder of this lesson discusses the physical characteristics of bone and the types of joints formed by the joining of particular bones. We will also go over clinical terminology of body planes, positioning, and directional terms.
In radiography, we will spend most of our time with the skeletal system. In the notes sections, we list some brief information about each of the 11 organ systems. However, because the X-ray field is all about the skeletal system, we will discuss details of bones such as types, positioning, structure, and movements. The bone structure in the human body vary, depending on where on the body they are located and what function they are made to do. The 4 basic types are long, short, flat, and irregular. The outer portion of most bones are consistent of a hard layer of compacted bone called the cortex. Inside the top layer is bone tissue that looks like a honeycomb structure that is called the trabecular, which is spongy bone. This spongy inner layer is called the cancellous. Long bones have a long cavity in the center called the medullary canal. The medullary canal and the spaces within spongy bone contain marrow, a fatty substance containing blood vessels and immature blood cells. The long bones are all found in the extremities. The parts of a long bone will be in the notes section for you to observe. The long shaft of the bone is called the diaphysis. At each end of the diaphysis is a flared portion called the metaphysis. The rounded ends that form joints are called epiphyses. Between the metaphysis and the epiphysis is the epiphyseal plate or growth plate. Early in life, this plate is made of cartilage and is the center for bone growth. When the bone is mature, it turns to bone, which is called ossification. The growth plate can often be seen on radiographs and is referred to as the epiphyseal line.
Because the structure of bone and its surfaces are unique and differs with how it connects to muscle tissue, the bony landmarks are all named and serve a purpose on what they do. Projections, which grow out of the bone surface, and depressions, which sink into the bone, both are specific terms that are used to describe these features according to their unique characteristics. Please review the names listed in the notes section. Some are descriptively named, which can be easier to remember, but it probably isn't necessary to memorize all of the terms for the exam. Joints are the places where bones are joined together. That is why they are called joints or articulations. There are 3 classifications of joints based on their ability to move. The first one is synarthrosis, which refers to a joint that does not move. With the exception of the mandible jaw, examples of these joints are all over the skull. These are all synarthrodial joints and are also called sutures. The second is called amphiarthrosis, which has very limited motion. The articular surfaces that form these joints are covered by fibrous cartilage or cushioned by discs of fibrous cartilage. The joints between the bodies of the spinal vertebrae and the joints between the pelvis are examples of amphiarthrodial joints. They have limited motion and contain cartilage between the vertebrae that cushion the movement when we walk and do bending movements. Diarthrosis refers to a joint that can move freely. The bones of these joints are shaped to fit together to accomplish the movement, and their surfaces are covered by articular cartilage. A fibrous capsule lined with synovial membrane surrounds the joint. This membrane secretes synovial fluid, providing lubrication when it moves freely. Some diarthrodial joints have sacs filled with synovial fluid. These are called bursae, singular, bursa. They serve to cushion the movements of tendons or muscles. Important bursae that we use when we move are located at the shoulder, elbow, hip, and knee.
Joints allow a number of body movements. The following terms are used to describe these movements. Many of these terms are used in the patient positioning instructions we give to patients, so it is helpful for BMOs to understand their meanings to communicate effectively. Circular movements include rotation, circumduction, supination, and pronation. Rotation is defined as the pivoting of a bone on its axis. Moving the head from side to side and all around requires pivoting of the first cervical vertebra around the odontoid process of the second cervical vertebra. Circumduction moves the distal end of a bone in a circle, resulting in a conical-shaped motion. When a person throws a ball, the throwing motion requires circumduction of the arm at the shoulder. Supination is lateral or external, rotation of the bones of the forearm, so the palm of the hand is facing up or anterior. I remember this movement by pretending like I am asking for a cup of soup with my hand. Supination equals soup. Pronation, the opposite of supination, is medial or internal, rotation of the bones of the forearm, so the palm of the hand is facing down or posterior.
Angular movement is commonly referred to as bending, resulting in a change in the angle between the long axis of the two bones making up the joint. Picture the arm as a triangle, and you are increasing or decreasing the angle. These angular movements include flexion, extension, abduction, and adduction. Flexion is a bending motion that decreases the angle between two bones. An example would be to bend the arm at the elbow joint so the forearm moves closer to the humerus. Think of a person flexing their arm when trying to show off their biceps muscle. When looking at the foot, flexion looks opposite to the arm. A specific type of flexion, called dorsiflexion, occurs when the top of the foot is moved so the toes are pointed up towards the front of the lower leg. This decreases the angle between the top, or dorsal surface, of the foot and the shin. Plantar flexion, the opposite of dorsiflexion, is movement of the foot and toes away from the lower leg so the angle between them is increased. You can picture pointing the toes away from the leg like a ballerina standing on their toes. Extension, the opposite of flexion, is a bending motion that increases the angle between two bones. The arm is extended at the elbow joint when the flexed arm is returned to anatomic position. Moving the arm from a flexed position to a position straightened out is extension of the arm. The term hyperextension is used when a joint is extended beyond its usual anatomic position. This is not considered a normal joint movement. Bending your back backwards to where you are about to fall back is considered hyperextension.
Abduction is movement of a body part away from the middle or midline of the body. An example would be movement of the arm or leg straight out to the side of the body, without moving it forward or back. Adduction, the opposite of abduction, is movement of a body part toward the midline, or toward the body. An easy way to remember this difference is that adduction adds to the body by moving it toward the body, or adding it. Gliding movement occurs when one bone slides over another. These simple motions occur without any circular or angular movements. Examples include the movement of the patella, kneecap, over the femur with knee flexion or extension. The final types of diarthrodial, freely movable joint movements are called special movements. They do not fit into the other types and occur in a limited number of joints. Special movements include inversion, eversion, protraction, retraction, elevation, and depression, all of which are described in the notes section.
Inversion means to turn the foot sole or plantar surface inward. Eversion, which is the opposite of inversion, is turning the sole outward. Protraction is moving a part of the body forward or anterior. Holding an arm straight out in front is an example of protraction. Retraction, the opposite of protraction, is moving a part of the body backward or posterior. Elevation moves a part of the body up or superior. Depression, the opposite of elevation, moves a part of the body down or inferior. When discussing radiographic positioning, know what to do when placing the body in the proper position to create the best X-ray you can. Giving patients correct positioning instructions require the inclusion of terms that describe the relationship of body parts and the location and orientation of body structures in place. Think of it as using medical lingo to communicate. Know what terms mean in a clinical setting. Terms that indicate these anatomic relationships are based on the anatomic position, which is defined as the patient facing forward, arms extended, and feet and palms facing forward. Review the many terms in the notes section and the descriptions in order to understand the clinical terms used to describe anatomic locations, orientations, and body part relationships. These medical terms may be used in the framing of exam questions, and if they are unknown to you, they might cause confusion when trying to figure out the right answer. It may not be crucial to memorize all the terms completely, but knowing the terms will be helpful. A lot of exam questions will be situational that describes a patient getting an X-ray, asking what to do or not do to get the best image possible.
Body planes are used to describe radiographic and anatomical positioning. The sagittal plane divides the body into right and left portions, and the coronal plane divides the body into anterior, front, and posterior, back portions. The transverse or horizontal plane divides the body into superior, upper, and inferior, lower portions. The body planes can be described or imaginarily drawn at any level on the body, not always exactly in half. Try using the body planes terms when describing a location of a body part for practice. My belt is running in a transverse plane across my waist. Using radiographic positioning terms are useful when seeing the patient or body part in relation to the X-ray table or the image receptor, IR. View the notes section below to learn all of the positioning terms involved. Be careful not to confuse the patient direction in relation to the image receptor, IR. For example, when taking a chest X-ray, an PA view means posterior anterior, so the X-ray will travel through the patient first in the posterior and after the anterior. If you visualize the patient positioning, the patient should be facing the IR and their back is toward the X-ray tube.
This brings us to our next topic. Radiographic projections indicate the path of the central ray from the X-ray tube through the patient to the image receptor, IR. Most are named, in anatomic terms, by the central ray entrance and exit points in the body like the example that Andrew gave earlier. AP stands for anterior-posterior. PA means the opposite, posterior-anterior. Lateral is the side view where the sagittal plane of the body is parallel to the image receptor. This means the body is placed at a right angle to the IR so that the central ray passes through the side of the body. If any of the projections confuse you, be sure to observe the diagrams to see how the patients are positioned and where the central ray passes through to get to the image receptor. Oblique view means the body is rotated in a way so that the central ray goes through the body at an angle. Oblique projections are named by the entrance and exit point of the central ray. Axial views are a longitudinal angulation of the central ray of 10 degrees or more. Two terms are used in axial projections: cephalad, which means toward the head, and caudad, which is toward the feet or away from the head. The last X-ray projection to mention is the tangential view. This specialty view is produced by directing the central ray to skim the patient's body part in order to isolate the specific body part of interest. A common tangential you will take a lot during your time as a basic machine operator is the patella of the knee. Skimming the patella on a patient with a knee injury will show the patella by itself without the rest of the knee getting in the way of the image. All right. Great job today going over patient anatomy and anatomical positioning. Be sure to look over the notes section to become familiar to the medical terms and definitions. Practice makes perfect.
Have a great day, and thank you for all of your hard work. Keep it up, and we will see you on the next lesson.